that's the key differentiator for us.
It's interesting that it takes a certain model that has mostly to do with money for people to even have that opportunity.
Because of things like the Tuskegee study, where government intentionally gave people syphilis and then observed those black folks for 40 years and didn't tell them that they had it.
I mean, I wish that there wasn't a connection with the health literacy rate, but we know that there is a lower health literacy rate in Black and brown communities, so there has to be a different approach.
Sure. Social media is a great tool. If you're a family physician or internist or pediatrician and you want to share about what you're doing and why it matters and how you're helping people every day.
Well, hello! We are live. It is SHANKX and Yes, and we are waiting for Dr. Paul Thomas with Plum Health. He should be joining us any moment here, and we can have an interesting discussion on Health Literacy Month. And he should be joining us here any moment. There we go.
Hi there.
Hey, how's it going?
Good. How about yourself?
I got my mask on because we're going to have some patients coming into and out of the office, so I'll have it here with me, and if anybody walks in, I'll have to throw it on.
Okay.
How are you guys doing today? Great to see you.
Fantastic.
Good to see you too.
Yeah.
It's been an eventful month for you with TEDx and with the Hint Summit 2D and everything else.
Yeah, for sure. It's been a lot, but yeah, that's usually how it is. I've usually got a few different irons in the fire, and it was great being at Hint because I love working with our physician colleagues and helping them grow their DPC practices. And then the TEDx thing just kind of came up last minute, and I was really glad to make a submission for that.
Mm-hmm.
And both of those were great events. It would have been nice to do the Hint Summit in person. It would have been great to do TEDx in person, but you know, COVID's been a wild year, so I'm gonna have to roll with it as is.
Yeah, we were talking about that. Don't you think that there were a few advantages of the virtual format, because we felt like it was a lot easier to talk to quote-unquote VIPs. You know, it was kind of more democratic access to the different participants of the summit.
Yeah, I mean, I was in that like they had a random chat assignment room that you could get into, and
the speed dating.
Yeah, the speed dating, exactly. And I jumped in on that, but I didn't run into. I ran into the people I usually run into. I didn't like run into Z-Dog or. Actually, I did meet Dr. Bliss at the Hint Summit in San Francisco a couple years ago. And I also met Z-Dog at the Hint Summit in person a couple years ago. He was the keynote a few years ago as well. So I actually like the live better because I actually made more intentional connections, and I feel like it was a missed opportunity. I would have loved to have met Marty Makary in person, Dr. Marty Makary in person, but whatever. It's next year. C'est la vie will be better next year, I hope.
That's so funny because I did run into Dr. Bliss. Actually, that was really fun talking with him. And Dr. Makary came down, in March of this year after I wrote a piece, actually. And he wanted to come down in San Antonio to meet with us, and we had him speak at the San Antonio Free Market Medical Association. So this year has been very interesting for those of us who are not doctors, but are still operating in the medical health space. So
that's amazing.
It's awesome to have you with us too.
Yeah, if you don't mind, Dr. Thomas, I always am very curious about a doctor's childhood. What were his circumstances, and what kind of gave him the idea to pursue that profession?
Yeah, so I grew up in and around Detroit. So I was born in Detroit, and my family has roots here for a long time, but I actually grew up in Grosse Pointe, just east of the city, and it's probably one of the starkest contrasts between one neighborhood to the next, just in terms of net income, how the houses look, and the really distinct contrast that you can see between the two neighborhoods. So going across Alter Road from Grosse Pointe to Detroit to visit my dad at work. He worked downtown, so sometimes I'd ride my bike down there. Or I played hockey growing up. There's an ice rink in the city that we would go to frequently. Or for different projects, I was an Eagle Scout, and so I did a couple of projects on Belle Isle to help beautify the island growing up. So I was always acutely aware of those differences, and in my personal statement I wrote about, part of my mission was to try to palliate the divide and just make both sides better by creating connections between the two, and so part of my career has been focusing on how I can bring people together in Detroit and across the region, and that's something I'm really happy to be doing. And my current clinic is bringing people from all backgrounds together in one space. And then the other thing I did growing up is I started volunteering at Cass Clinic, which is a free clinic for folks who are uninsured or otherwise vulnerable in the city of Detroit. And I started volunteering there at 17. And I got to work with medical students from Wayne State University School of Medicine and a family medicine physician. And I really identified with the work that they were doing and the way that they were able to have a tangible impact in the community just by volunteering. And I dedicated myself to becoming like them and wanting to become, my goal at age 18 was to be a medical student at Wayne State, because I thought that was a really cool thing to do and interesting skill set that they got to use, and that led me to that path of becoming a family physician.
And at that time, did you know about the delivery model of direct primary care, or when did you become aware of that?
Yeah, this was 2004, 2005. So I became aware of DPC in my last year of medical school. And I listened to another direct primary care physician on a podcast, and I really identified with what he was doing. He just sounded really enthusiastic about the practice of medicine and the delivery of care in the DPC model and how he's saving people money. And I wanted to do that. But at the same time, I kind of wanted to be like a hospital-employed doctor, maybe work in a residency program, teach younger doctors how to become great physicians. And so I kind of always pictured myself as like a faculty member. But then at the end of my residency, I just saw how burned out my physician colleagues were and how unhappy they were with the direction that medicine was going just in the short, the last 5 to 10 years. And they're really disenchanted by the whole thing, and I was like, I got to get out of the system. Let me revisit that podcast and learn more about what direct primary care is and how I could pull this off coming out of residency.
And wow, that must have really been a pioneer. Who was that person that inspired you?
Yeah, so that was actually Josh Humbert, and that was 2012, and he was talking about his newly launched DPC practice called Atlas in Wichita. And so in my third year residency, I met Clint Flanagan as well at a conference in Michigan. And so I drove out in March of my last year of residency to visit both Dr. Humbert and Dr. Flanagan. And I took the best of what they were doing at their DPC offices and brought it back to Detroit to create my own office that I could be really proud of and serve my community in that way.
So would you say that DPC kind of saved you from leaving primary care altogether?
Yeah, I would say so, because I'm much happier and much more fulfilled. I don't think I would be practicing or doing as much. You see me, I'm out here doing a ton of stuff and really advocating for the profession. And that's because, I'm doing what I love, and I want to share this kind of care with other people and help patients and doctors uplift this model and create a better primary care system. So I may still be practicing in the fee-for-service model, but I just feel so much better. If I wasn't doing this, I'd probably be doing something unique something different with my medical license.
Mm-hmm. So I know we met, I think, about 2 years ago at a direct primary care summit, and it is safe to say that you were already back then a thought leader in this niche of the industry. And one thing that you have really mastered, which is of interest to us as marketers, is you have really found a way to leverage digital media, social media, to spread your message and also to build your practice. And I know you've given hours and hours of talks about the topic, but here we go again. How have you used social media, and what works, and what would you advise to someone else who wants to tackle that alone, because they don't have the budgets yet to work with a marketing agency?
Sure. I will say that, let me just start by saying that social media is a great tool. If you're a family physician or internist or pediatrician and you want to share about what you're doing and why it matters and how you're helping people every day, social media is just a fantastic tool to do that. And that includes YouTube, Facebook, Instagram, Twitter. The most powerful platform, in my opinion, is Facebook. It reaches the most people, and it has the broadest audience. But there's a lot to be gained through YouTube and LinkedIn and Twitter, and I know some doctors are on TikTok as well. And a lot of doctors are made nervous by social media because they're concerned about privacy and what they're sharing. And they also don't see it as a tool, they see it as a distraction. And so, Facebook and these social media platforms can be a really powerful tool if you use them as a tool and which levers to pull to engage with your audience. And so personally, my strongest audience is on my personal Facebook page, and I get a ton of engagement every time I post or share a story there. And so my advice to doctors is, if you're struggling to grow your practice, you can use these tools. And I will plug myself here. There's no way I can go through all the content I would want to share with you. So I do have my book, the Startup DPC book, and it's a big one. It's like almost 400 pages. And then I also have a couple of courses on my website, again, startupdpc.com, and I really take people step by step how to grow a social media channel and leverage that channel to get more customers or more patients or help more people. And the gist of it, at the core of it, is you're sharing your competency, you're sharing your character with your audience on a consistent basis and telling them how you can be of benefit to themselves, to their families, to their small businesses, and that's how you grow your practice.
Yeah, I like what you said about sharing on your personal page as well. I often see a false humility, if you will, that people say, oh no, I don't want to bother mix professional with personal. But at the same time, especially for a primary care doctor like you, this is your life's work, and sharing that every now and then on your personal page, I think, makes a lot of sense.
Totally, and it comes from an authentic place. I'm not bragging or boasting. It's just I'm telling people what I'm doing every day. And it might be, taking my dogs for a walk or going out to dinner with my family, or it might be traveling somewhere cool, or it might be, removing a toenail in my office, or giving a joint injection, or saving somebody money on their medications. All of those things are part of who I am, and they all make me happy. So I'm going to share all of that stuff. And oftentimes the work that I do in my clinic really resonates with the people in my community, so I keep sharing about that.
And I know, correct me if I'm wrong, but I believe your activity on social media has also given you some nice opportunities to be featured in the press. I think you were on TV. There were numerous articles where you were featured in. Is that correct?
Yeah, we've been in the Detroit News, Detroit Free Press. There's a business periodical here in Detroit called Cranes Detroit. We've also been in the major network TV programs that reach like 4 million people in the metro. So there's like Channel 4 is NBC affiliate in Detroit, Channel 7 is the ABC affiliate. We've been on Fox 2 and CBS 62, which is the CBS affiliate here in Detroit. So by leveraging these channels, we've made a lot of connections, and just by delivering good medical care to our patients, they've introduced us to people who can help us in our journey as well. So it's, you know, a couple different things that we do help us get in touch with, you know, traditional media channels. And, you know, not to sound like a broken record, but I do teach people how to do this in one of my courses. I go into depth. It's like a 2-hour course on how to engage with the media and how to get your message out there.
Mm-hmm. Something that I am interested in too, and we can kind of segue into the health literacy part here a little bit, because with DPC we know firsthand there's always an education component that you need to overcome, on letting people understand what is the different approach. And then on top of that, I believe your population in Detroit might be one that needs potentially even more education due to their background. So what can you tell us around that topic?
Yeah, for sure. I think educating the community is one of the biggest challenges for any direct primary care doctor, because you're doing something unique, you're doing something different, and your target audience, or the people you're trying to serve, the people you're trying to help, really only know insurance plans and, you know, why isn't this covered by my insurance? And that's something I encountered in my community. You know, it's Detroit, it's a blue-collar town. A lot of people have union jobs where their health insurance coverage is like part and parcel of employment. And so there's a lot of barriers here, especially in this town, where people have Blue Cross Blue Shield associated with their union job at Ford Motor Company, so they don't really want to pay a dime over and above that insurance coverage. So a lot of what I do is I'm not really focusing on features and benefits. I'm more focusing on what we believe in and why we exist, as you know, in a lot of our media messaging or social media messaging. So we believe that healthcare should be affordable and accessible, and that's why we make house calls for people who are shut in or elderly or disabled who can't otherwise get out of the house. So I'm not really selling like the house call. I'm selling our belief in lowering the cost of care and making it accessible for more people. And a tool that we use to do that is making a house call. Likewise, you know, I have a lot more time with my patients, and that allows people to get to know me more. And so I'm also, you know, giving people a better relationship with their primary care physician. And so a lot of times when I'm messaging my social media channels, I'm talking about why we do what we do, not necessarily how we do it. And I feel like that resonates more with people who want to be a part of our service.
Got any questions?
Tons of questions.
Yeah.
I mean, I'm curious.
I go.
I mean, Detroit is 80% of the population is Black, and I mean, I wish that there wasn't a connection with the health literacy rate, but we know that there is a lower health literacy rate in Black and brown communities. So there has to be a different approach, a different strategy and we know that that's also because of historical injustices that prevent access to care, that prevent access to education. We know there's lower educational attainment on the whole. So what are some of the strategies that you use when you're dispensing health information to make sure that your patients are really grasping what you're understanding? Because I think one of the problems is that some of the times patients don't even understand what they don't understand. They don't understand that they have options. They don't understand what medications are really going to do, or what happens if they don't take them, or things like that. So, or that the alternatives that are even possible to present to them. So I was curious to know what your conversations look like, also what the demographics of your panel are, and what are some of the initiatives that you, I'm sorry, there's a lot of questions. I'm gonna just slow down so you can answer at least one of them.
For sure, yeah, so there's a lot there. You know, there's also a digital divide, meaning that like there's a lot of folks who live in our urban community who don't have access to social media, don't have access to computer or phone. And so that's why it's important for us to do a lot of outreach. We worked with some of the hip-hop R&B stations in the community, and we've had some interview segments on those stations to get the word out to people in that demographic who listen to that station. We've also done a lot of radio interviews with the local WDET channel. I've also worked with librarians in the community. If you don't know, librarians are a great resource. If you're a family physician, you want to reach out to people. They keep track of family medicine physicians, opportunities for low-cost healthcare in the community, and then also speaking engagements. I speak at the YMCA. I've spoken at some of the lowest income communities in our metro area, like Highland Park. They had a group of elderly men who meet up every week, and they asked me to come out and talk to them about prostate health. So different ways that I engage with different communities offline are really important strategies. And then also just using simple language around the health information that I'm trying to communicate. And that's really done on an individual basis, patient by patient, but it's also evident in the information we share on our website. A lot of the stuff that I write online is more or less at an 8th grade reading level, just so that I can reach out to everyone. And then you talked about our patient panel demographics. I do have some of that online. If you were to Google Plum Health DPC patient panel by age, the vast majority of our patients are between 26 and 65. 10% of our patients are in the geriatric age range, 65 and over, and then 10% of our patients are pediatric, meaning 18 or younger. Over 50% of our patients live in the city of Detroit. The city of Detroit is 86% African American, and then about 50% or less are coming from suburban or communities outside of Detroit. So we take a look at those demographics and make sure we're serving the people we're trying to serve. But frankly, our patients come from every demographic. It's a very wide swath of people that we take care of. Recent immigrants, Spanish-speaking patients. We take care of a lot of what you would call old Detroiters and Detroit families that have been here for generations. We take care of a lot of new Detroiters, younger, whiter folks who are moving here for the first time, and suburbanites and everyone in between. So it's really a broad mix of patients.
I think that makes your practice different, because I know that when you just drop in one population group, like pediatrics, for example, that changes everything from what you offer, who is actually on board your team, and what they specialize in, the kinds of vaccines or medications that you keep on hand, the places that you tell them to go. So that's really awesome that you do that, as well as engage with your patients and going outside of the four walls of your clinic into the community itself, because that's a part of being really in a good position. What DPC does for you, you already have that direct doctor-patient relationship, you're restoring the trust, but it's so important to go out into a community where, again, I am Black, so I have a vested interest, obviously, but you think about the Tuskegee study, where all of these Black men were injected with syphilis, for 40 years, and that's, my grandfather can talk about the mistrust that he has, and he doesn't even necessarily understand exactly where it comes from. But with initiatives like this, when you're going out into the community and you are building this relationship and you're helping people, and you have simple language probably on your brochures, and of course we've seen your website and the talks that you have, having simple graphs or charts or lists and things that people can understand. I think that, quite frankly, a lot of healthcare practitioners either overlook, or it's just not important enough to them because they have a full panel, they have enough patients, or it's just not their main priority. And I think the fact that you think about these things is really, really important in terms of getting that word out, word of mouth, those kinds of referrals, because people can actually say that they have trust in you based on a personal connection and things that you're doing out there. And having an awesome team behind you that is also diverse, full of women and of color as well. And I think we need a lot more of that, but you're also very young to be doing all of these things too. So yeah, and there's also, because you were talking about that, I see here the pediatrics for everyone interested. So
yeah,
that's
our
pretty cool.
newest patient.
And also,
let me riff off of that for a second.
yeah,
Because let's unpack a couple of those things. But it's true, a lot of Black folks in our patient panel are really wary of even a simple thing like a flu shot, because of things like the Tuskegee study, where our government intentionally gave people syphilis and then observed those Black folks for 40 years and didn't tell them that they had it until I think it was like something. I think it ended in the 1970s.
Yep.
So it's really still fresh and recent and raw for a lot of people. And so I know patients who don't get a flu shot, the first year they see me, but after I talk to them about what it is and why it's important, maybe they get it the next year. And that's happened a lot in our practice, where just having enough time and space to explain what the flu shot is. What I tell people is the influenza vaccine takes the flu virus and breaks down all the proteins and it removes all the RNA, so the virus cannot replicate within your body. We're just giving you the protein from those flu strains from last season. And they start to understand that. I show them the picture, I show them the viral capsid, I show them the proteins that we're going to give them. And I tell them, frankly, your body is going to mount an immune response to this. So you cannot get the flu from the flu shot. However, your body will make an immune response. About half of the people who get the vaccine develop some kind of immune response where they feel under the weather for 2 to 3 days after getting the shot. So it's really important to actually get the vaccine and stimulate your immune system, because it's going to give you protection from the season. And by the way, about 60,000 Americans die from the flu every year. So this can help you prevent an ICU trip, getting really sick and being away from work for 2 weeks, and potentially even dying in a rare case.
I think that's
hey,
a part
Mo
of.
Thanks for. We got Dr. Mo Saeed is joining us. Arabian Nights, Object Apparel, Indie Direct Docs. Thanks for dropping in on us, guys.
Hi, everybody. I was going to say that that's a part of cultural competency, knowing the history, the medical history of different people groups that you deal with, whether it be immigrants, whether it be African Americans, whether it be women, because a lot of terrible things have happened to women, or Black women too, where gynecology was basically founded on the experimentation of Black bodies, Black women bodies. But again, this restoring the trust and dispensing health information, explaining to a patient you are not going to feel well, so they know what to expect, so they can't run off and say, I got the flu anyway and it didn't work, and all of these kinds of things. And I'm sure that carries over with procedures that you give, or small, explaining why they need to maybe see a specialist for a certain type of surgery, or things like this. I think that is exactly what direct primary care is supposed to be. And it's interesting that it takes a certain model that has mostly to do with money for people to even have that opportunity. That you have to be able to go directly to the doctor because of all of the constrictions that happen when you are bound to a third party who has special interests, and you not necessarily knowing those things, not knowing that you can have alternatives, or you can switch to a generic medication or things like that. And that's kind of part of what we do as well, because we are a full service health marketing agency, and we need to write for our audience to understand what it is that we're offering our customers.
Yeah, there's a lot there, and I think when people join our practice, they're obviously looking to us. They're giving us their trust. They're trusting us with their most valuable resource, which is their personal health. And so, if you're choosing to engage with us, I'm going to take the time to explain why I think this procedure, why I think this vaccine, why I think this medication can be really helpful for you. And then I'm going to explain exactly how it works, so you have a clear understanding of what it can do, what the side effects are going to be, and how it can eventually help you in the long run.
Yeah. So it sounds to me like we talk to a lot of DPC docs, and they are all very, very enthusiastic about telemedicine. I didn't hear you push that quite as much, and I like it because you on the contrary, you spoke about house calls, right? And it makes a lot of sense how you described it. So how do you see telemedicine in the future in your industry?
Yeah, I mean, telemedicine is a good tool. I mean, I use telemedicine every day in that I text and email my patients and I call them, and then, I don't have to worry about reimbursement because, a patient, frankly, it's much more valuable if they text me and I respond within 3 minutes than if they can have a, 30-minute telemedicine appointment in a week. If you have a sore throat and you're texting me and I can respond to you in like 2 or 3 minutes, that's way more valuable than scheduling like a telemedicine FaceTime appointment in a week from now, because by that time it's probably resolved. And so for me, it's more about giving people the immediacy and the attention and the responsiveness that they would want from a doctor who's like, it's kind of like having a doctor in the family where my patients can text me and I can get back to them right away. And then I always leave about 3 hours empty in my schedule every day. So if I need to fit in like a quote unquote urgent care visit, they can come in and be seen. Like for today, my 4 and 4:30 were available. My 4 o'clock filled up, 20 minutes ago, 30 minutes ago, somebody texted for that appointment slot. But I had about 2 free hours of my day today where I could have filled up appointment times. And same for tomorrow. I'm looking at maybe 3.5 hours tomorrow where if somebody needs something urgently, they can get in right away. Mm-hmm. And so for me, telemedicine isn't like, let's FaceTime and do this sort of thing. It's more like, send me a text or an email or call me right away when you need something so I can help you right away and resolve that problem for you.
Mm-hmm. Yeah, and DPC lets you be quick in that too. And I know we sometimes, and I think we did it on this call too, we make the assumption that our audience knows what direct primary care is.
Joel Fontana, great to see you, man. Thanks for joining. Hope you're doing great out there in California. But talking about DPC today.
Awesome. Yeah, well, that's the question. In a nutshell, how do you typically explain what DPC is?
DPC is all about like creating really strong relationships with my patients, and that's the key differentiator for us. Is that when you're a member of our practice, you have my cell phone number. You can reach out to me anytime you need to, call, text, or email, and you can also you have access to these other like value-added services. We try to lower the cost of medication, labs, imaging for you. We successfully save people 50 to 90% on their labs and meds and imaging services. But that's not really like why people join. They join because they trust me. They trust Dr. Raquel Orlick. They trust Jamie Qualls, our third doctor up in Farmington Hills, to deliver them excellent healthcare services every day. Not just when it's convenient for us, but when they need it the most. And that's why people join our practice.
Where do you see Plum Health in 5 years?
I mean, we're hiring a new doctor just about every year. Wow. So I see us growing as more doctors find themselves, resonating within this model and having freedom within this model. Like I'm bringing on a 4th doctor in February, and so she's going to start with us probably February 1st. And it's really exciting to have her as a part of the team because she's a Spanish-speaking physician and can serve another demographic of our community that we can't fully adequately serve at this time. So it's really exciting to have her as a part of the team. But I continue seeing us grow to meet the needs of our community in a unique, really, truly patient-centered way, and focusing on the needs of the community and growing based on how we can serve people.
So I had a question because Shankar earlier had mentioned, I was like, I don't understand, like how is this doctor so communicative? Like he is really able to get back to you. He's really like just attentive and there. And now I know that there's other doctors on the team, but he said, well, he probably spends quite a bit of time going on the conferences, and because like you have, startupdpc.com, and then you have your book that you've authored, and you have all of these engagements and all of this. Do you see the ratio of time that you spend maybe with your patients and doing engagement and elsewhere as being the same in the future, or I don't know, does that...
Yeah, I mean, that's a fair question. I'm planning, I usually spend about, 5 to 6 hours every day taking care of my patients, and then 2 to 3 hours every day working on the business or growing the business. And those ratios may change slightly over time, but as of right now, it's working out really well, and I feel really good about taking care of patients. That's why I started this journey in the first place.
You're not letting go of those patients. You're not letting go.
Yeah, not yet. We'll see. I mean, I really love taking care of the people in our community, and it gives me purpose every day. And so it's a really nice place to be. But I'm definitely find myself working a little bit more on growing the business and doing outreach and engagement for the other doctors that are joining. People or don't know exactly what to do or how to do it. Hesitant. So I really spend a lot of time. Like yesterday, I worked for maybe 2 hours on generating reviews for our third doctor up in Farmington Hills. So I reached out to 20 of her patients and asked how their experience was going, and they all responded positively, the folks who got back to me. And then I asked, if you feel that strongly about it, if you can drop a review on Google, it really goes a long way to helping us reach more people. And so we had 8 people take us up on that offer. So she went from 7 reviews on Google yesterday or 2 days ago to having 15 today. Mm-hmm. So, those are the things that, are kind of behind the scenes that help grow the business and help us reach more people. So those are the kinds of things I work on. Hey, my next patient is walking up here, so
okay.
I'm going to throw on my mask, and then we might have to wrap this up here shortly.
I am thinking of Ikigai. I think that's how you say it.
Yeah.
And
Ikigai,
yes. And I don't know. I don't remember the other thing else.
All right. Well, I think give you one more opportunity here to tell us how people can find you and your book and your course, and then we can wrap it up.
All right. So how to reach out to me? I'm on social media, Facebook. That's here. So Plum Health DPC is my Instagram. Plum Health DPC on Facebook as well. If you want to learn about our practice, plumhealthdpc.com. And then if you're a doctor looking to do this with your patients, Startup DPC, the book, and then we also have some courses on our website, startupdpc.com. And you'll probably catch me if you go to the conferences, you'll see me at the AAFT conference. You'll see me at the HINT Summit, hopefully next year as well, and keep on reaching out to people and helping grow the movement.
All right. Thank you so much, Dr. Thomas. Have a great day. I hope you can reach many more people and improve lives, and I'm sure we'll meet again very soon.
Yep. Thank you so much for having me on, and have a wonderful day. Stay safe out there.
You too.
Bye.
All right, take care.
Bye. So there you guys have it. That was our lovely interview with Dr. Paul Thomas of Plum Health DPC in Detroit, Michigan. And we hope that you have learned a little bit more about why National Health Literacy Month is important. Also hope that you learned a little bit more about what DPC marketing doctors can do. And what else do you have to say?
Well, I just want to say that, of course, Dr. Thomas is very well versed in social media. He feels very comfortable in doing all of that himself. And we know that not everybody is in that situation. So
right.
Just wanted to throw that out there, that if you need a little bit of help, we can certainly give you pointers. Doesn't mean that you need to hire us right away or at all, but we're certainly as passionate as he is about DPC and how you can make changes. And if you just want to have a quick call and have some ideas of what you could say and how you could say it, which platforms, we're certainly here to help you for that as well. SHANKX Web Development, at this point, if you're watching this, you are already connected to either our Instagram or our Facebook. Also, once this video is over, don't be afraid to reach out with additional questions, leave a comment or whatever works. We hope you have a great rest of your day. Thank you for checking in, and we'll see you again here on Facebook and Instagram. Bye.